Are you suffering from hernia or any conditions related to hernia? If you or your family member is suffering from hernia, then today's episode is going to be very helpful and useful for you and your family. If you are new to this channel, please subscribe to this channel where I share various tips, tutorial ideas related to various health conditions, and I invite different guests from medical specialty, doctors and healthcare experts who guide you on various medical conditions. So please subscribe to this channel for your health benefit. And we are having a special guest today to talk about hernia and various questions related to hernia. So today we have a very special guest on our podcast, who is Dr. Premkumar Balachandran, and who is a clinical lead at Apollo Institute of Hernia Surgery and Abdominal Wall Reconstruction at Apollo Hospital, Chennai. And he is an expert in gastrointestinal surgery, minimal access surgery, bariatric surgery, hernia and abdominal wall reconstruction. I welcome you, Dr. Prem Kumar, to this special episode.
Thank you. Thank you for the kind introduction. Pleasure is mine to be here.
Yes. So, Dr. Prem, today we are going to talk about hernia, and we would like to seek some guidance from you. So, to begin with, can you tell us in a very simplified language for the audience of this channel, what is hernia? What is this condition is about?
See, so basically, our body and the organs, each of them is supposed to be in a particular position. Okay, due to any reason, like a previous surgery or by birth, if these organs are displaced from their location into another location, this is called as a hernia. Okay, so there are a variety of hernias, and hernias is a very, very, very common condition that one faces in his life.
Okay. So, Dr. Prem, can you tell us like what different types of hernia have you managed?
There are many different kinds of hernias. One is called as a groin hernia or inguinal hernia. The inguinal hernia is the inguinal region, rather, is the area where your groin meets your thigh. Okay, that is called as the inguinal region. And suppose the intestine is trying to come down into this area, it is called as an inguinal hernia. And inguinal hernias, there are a few types of hernias like direct, indirect, femoral. So all these hernias together is called as groin hernias. Next, you can have, for some people, they will complain that they've got a lump or a swelling like thing in the belly button. This is called as umbilical hernia, which is very common. Then some people also complain of a swelling in the upper part of the abdomen. That is called as an epigastric hernia. And some people can get hernias after a surgery because of the weakness of the previous surgical scar. You will develop a hernia there. That is called as an incisional or a ventral hernia. Apart from this, you have internal hernias, hiatus hernia, but let us stick to these more common kind of hernias.
Okay. So, thank you, Doctor, for sharing those different types. Can you tell us like what are the common causes behind these different types of hernia? Like, are there any common reasons behind this in particular?
There are, we can, yeah. So the different reasons are, one, it's called as a congenital hernia. That means by birth itself, they've got this defect there. See, normally before the male is born, the testis, both the testes are actually intra-abdominal. And as they grow, gradually the testis comes down and goes into the scrotum. So as it is crossing the abdominal wall, there is a potential weak area. Normally, the defect should be closed. But as people grow older, either due to weightlifting or chronic coughing or smoking, or any condition that increases the intra-abdominal pressure, it tends to push the intestine. It tends the hole to open up and the intestine tends to go through that hole and come down into the groin. So this is one of the most common conditions. So any cause which increases intra-abdominal pressure, coughing, weightlifting, smoking, sneezing, straining too much while passing urine, straining too much while passing motion, all these things tend to push the intra-abdominal contents outside. So these are the most common conditions for a groin hernia. In women following pregnancy, they tend to develop, ventral hernias, umbilical hernias. And following a surgery, suppose that scar becomes weak. Suppose the patient has got a huge scar in the abdomen. He's had an open abdominal surgery. And he starts working very early after the operation without giving it enough rest. Then what happens is the stitches tend to get loose, and through that you will develop a hernia. So this is called as a incisional hernia or a ventral hernia.
Okay. So, doctor, what I understand is that like whenever there is some increase in some body cavities, because of that, those organs are getting pushed, and it creates some kind of a problem or some defect in the body, which comes out most commonly as some kind of swelling within particular part of the body. So, apart from this swelling, are there any other particular symptoms which are related to hernia, which that patient should suspect that he might be suffering from hernia?
So the most common symptom is that the patient will complain that he's having a kind of a dragging sensation in the groin. Okay. And he also says that when he stands up, when he lies down, there is no issue. When he stands up, he finds that there is a small bulge in the groin. And this bulge tends to increase in size as the day goes by. And at night, when he lies down, the swelling goes off inside. This is one of the most common symptoms of a groin hernia. For an umbilical hernia, yes, they will say that they have a small kind of a projection in the belly button. And in a ventral hernia, it's pretty obvious. You will see that in the surgical scar, there will be a bulge. And whenever they cough, you will feel something going in and coming out.
Okay. And are these hernia painful, like commonly?
It depends. Small early hernias may not be painful. The early hernias usually, rather than pain, they will complain of a dragging kind of discomfort.
Mhm.
They're kind of feeling a feeling of heaviness. But as time goes by, suppose the intestine goes into the scrotum fully and it cannot reduce back, that is, it gets obstructed. Okay,
Mhm.
not obstructed, it gets incarcerated, that is irreducible. So in those conditions, definitely there will be pain. And obstruction is a surgical emergency where the intestine will get stuck and it loses its blood supply. So this is a life-threatening condition, and they will have severe pain in that condition.
Okay. So, what I can say is that in earlier stages, those are not much harmful or that much dangerous. But as the stage of hernia goes on increasing, or maybe there are some parallel complications, it increases the severity or dangerousness of the condition, right?
Definitely. So as far as there is no complication, hernia is quite a straightforward disease. But as in any other disease, once you develop a complication, then it becomes an emergency and life-threatening.
Okay. So, can you tell us like what kind of complications can happen in patients with hernia?
Okay. Complications per se is one, it becomes irreducible, where the swelling keeps staying outside the body, it does not go back inside. Next stage is called obstruction. In obstruction, it starts losing its blood. If they come and say to the doctor at that stage, probably, we can save the bowel, save the contents of the hernia. But if they wait for too long, maybe like 5 hours, 6 hours, and that part of the intestine completely loses blood supply, then you will end up removing that part of the intestine and rejoining that part of the intestine also.
Okay. So are there any like risk factors that the patient should be aware of? I mean, which kind of conditions can increase the occurrence of having this kind of hernia?
Anybody with a complete hernia is a hernia which goes down to the root of the scrotum all the way. So suppose somebody is having a complete hernia, initially it may reduce on its own. That is when he lies down, it will go back into the abdomen. Later on, if he starts noticing that the reduction is of the contents is slower or it is not reducing, then he should not take it for granted. He should immediately go and meet the surgeon because he will not know when it is going to go in for obstruction. Okay, so that is a very important symptom that the patient has to realize. Another symptom is when a patient has had a surgery and he starts, moving too fast, starts lifting weights too fast, and he realizes that there is some kind of a discomfort in the surgical scar, then probably the sutures are getting loose and he's going to develop a incisional or a ventral hernia. So these are some, what can I say, some warning signals that the patient needs to take, and he has to approach the doctor for medical treatment at the earliest.
Okay. And are there any like particular situations or maybe some occupations in that type of people this hernia are more common? Is there any relation?
There definitely is a relation. People who work in occupations where they are exposed to smoke and coal and they start coughing a lot, those kind of people, because they keep coughing, they can develop hernias. People who work who are laborers because they lift too much weight, they also, the abdominal pressure increases and they can develop hernias. Some people, they have a congenital weakness of muscle, like Ehlers-Danlos syndrome. There are some syndromes where they have, by birth, their muscles are weak. So these people are prone to hernias. Uh, Pregnancy is another cause because it can cause weakness of the previous cesarean scar. And recurrent hernia in the incisional, in the previous cesarean scar is a very, very, very common condition. More common that we think about.
So, doctor, you mentioned about regarding weightlifting also. So, is it common in people who are going to gyms and all those kind of people?
Yes, yes. I really haven't seen too many people from gyms coming with hernia. Yes, there are a subset of them. But if a person goes to the gym under proper supervision, if he's going to a trainer, he wears a belt properly, and they avoid lifting too heavy weights, then they can get away without hernias. Yeah,
Okay. So, if they are like doing their training under supervision and taking all the precautions,
exactly.
they will have
Precautions. Yeah,
less chances.
exactly.
Yeah. Okay.
Yeah, yeah.
And is there any particular age group relevance with this hernia? Like you mentioned about.
Hernias can occur at any age. Even a newborn baby can have a hernia, and even a 100-year-old man can develop a hernia. And so there is no particular age group which is more prone to hernia, definitely.
Okay. So this seems to be very common condition. So can you tell us at a high level how this is managed? Like how do you manage this condition?
There are different kinds of surgeries for hernia. Previously, we used to do what is called an open anatomical repair, wherein they will push back the intestine into the abdominal wall and they will put stitches and they will try to repair the hernia. But at that time, since you are suturing muscle to muscle, when you use pressure, the stitches tend to give way because it was a repair under tension. So the recurrence rate of these hernias used to be very, very high. Subsequently, there was a concept of tension-free repair, wherein you use a foreign body or a mesh. A mesh is like a net. We keep this and reinforce the repair, thereby, causing a tension-free repair, and thereby the recurrence rate is also reducing. But nowadays, we do a laparoscopy, and in laparoscopy, we go inside the abdominal wall, and from inside, we, cover the entire groin area with a huge 15 centimeter mesh, and the recurrence rate is much less. Recent advances, even more than that, you have the latest is robotic surgery also is available for hernia repairs.
So, doctor, you mentioned about these different kinds of surgeries. So are there any other options apart from surgery for managing hernia?
Unfortunately, no. Hernia is a surgically correctable disease. There's no role of medication at all in a hernia.
Okay. And are these whatever operations or surgeries you mentioned, are these dangerous or patient should be worried about?
I didn't get your question. Sorry.
So the list of surgeries that you mentioned, are these does this involve any kind of dangers or any kind of complications that
See,
patient should get?
every surgery has an element of risk. But having said that, these surgeries, if you come to the doctor at the right time and if adequate precautions are taken, if you go to a well experienced and trained doctor, usually nothing happens because these operations are quite straightforward. But if you're late stage, if the hernias are very huge, sometimes the hernias are so large, it is called as a scrotal abdomen. That is almost the entire intestine is in the scrotum because of the patient's ignorance, and they leave it for years and years and years. In those situations, if you try to push back all the intestine to the abdomen and try to repair the hernia, then they will develop respiratory complications and things like that. So, very large hernias are very difficult to treat, and that's wherein this new concept of abdominal wall reconstruction has come into place because multiple previous surgeries, the entire abdominal wall will become thin. They will not have any kind of strong muscles itself to, reapproximate. So therein we need to go into more complex reconstructions, and this field is called as AWR or abdominal wall reconstruction for more complex incisional hernias.
So, doctor, I must be sure that these complications, uh, if not treating the hernia, are more dangerous than the operations itself. So, still people are delaying or avoiding this kind of treatment. What do you think? Like, why they are delaying this kind of treatment?
I mean, no, it's very difficult to answer that question. It can be multifactorial. For some people, they just don't understand the importance of the disease that they have. They will think, okay, I've just got a swelling, it's not paining, so let's just leave it till something happens, and then they come in the last minute. Some people they are afraid to go to the hospital to get treatment, and some people, due to financial implications, think that I cannot afford the surgery. So there are, it's multifactorial actually.
Okay. So, what I understand is the fear of surgery itself, and there is a lack of pain. So, for the listeners of this podcast, if you are suffering from this kind of condition, please visit your nearest doctor immediately. Do not wait to get it complicated, because in early stages, it can be managed very easily. And the surgeries are also very patient friendly. The doctors are using very advanced technology, and you will not face any kind of complication. So, Dr. Prem, for the understanding of the audience, can you tell us what is the on an average recovery time after this hernia surgery?
Yeah, so if you are doing an inguinal hernia surgery by laparoscopy, you can go home the next day, and there will be some small stitches which you put on the abdominal wall, which we can remove on the 10th day. What I normally advise my patients is to carry on with the routine work immediately after the operation, but do not strain and lift weights for a period of up to 1 month. After 1 month, you can pretty much do whatever you want. In cases of ventral hernia, since we are closing it with stitches and we are placing a mesh, we don't want them to strain too much, because in the early post-operative period, we start coughing and all that, then the stitches can give way and cause a recurrence. So I suggest that they need to wear an abdominal belt, so a corset to protect the repair. And we tell them to wear it for 3 months throughout the day, except while taking a bath. After 3 months, they can get back to 90% of their routine. But even then, I would suggest that they try to avoid lifting heavy weights and straining too much for the rest of their lives. A complicated operation, well, it's very difficult to judge, because you cannot know what complication you're dealing with. But if you are having an obstruction where you need to remove intestine, etc., whether the patient needs to go to the ICU, in those cases, etc., obviously the recovery is going to be more prolonged. But regularly for groin hernias, it's just smooth sailing. Next day you go home, and 1 month you're back to 100% normal.
Okay. So, Doctor, apart from this, are there anything which needs to be changed in the lifestyle related to maybe diet or any other
See, in
activity?
today's world, in today's world, it's a very fast world, and everybody started getting used to eating junk food. You know, one set is working out too hard, because that has also become a obsession. Another subset don't work out at all. They just sit at home and always here on their mobiles. So living a well balanced life is the most important thing in today's world. Eat healthy, don't strain too much.
Hello.
Are you there?
Yeah, I think
Yeah, I'm here. I'm here.
yeah, I think I thought some voice was talking. Anyway, so what I understand is that maintaining a balanced lifestyle is a key to prevent and reduce any complications related to hernia, right? And are there any, like, even after like somebody goes for this kind of surgery, are there any chances of recurrence after surgery?
There is a 5% chance of recurrence. Like I already mentioned to you, some risk factors. If you do not follow the doctor's advice and start lifting weights or getting back to more strenuous activities immediately after the operation, then definitely yes, the recurrence rate is there. But otherwise, if you follow the doctor's instructions, the recurrence rate is less than 5%.
Okay. Hmm. I hope you have answered most of the questions, and still somebody if you are facing any questions or if you are having any doubts, please ask your questions in the comment section. so that we can reply to your question. Dr. Prem, uh, can you tell us like how do you support your hernia patients? Like,
Support?
yeah, how do you support
Can you
your?
repeat that question?
Yeah, I'm asking how do you support any hernia patients who are coming to visit you?
I don't get support in what sense?
Like how? What are kind of services do you provide to them specifically?
Okay, see, so basically, when any hernia comes here, you need to do investigations. Okay. So for inguinal hernia, I usually ask only for a ultrasound abdomen. And apart from that, we will do all the necessary tests to identify their fitness for surgery. You know, all your ultrasound, your chest X-ray, ECG, blood tests. For incisional hernia, we will have to do a CT scan because we will need to assess the musculature, the size of the hernia, the contents, the how strong the wall is, because we are planning to do a abdominal wall reconstruction. So we would investigate the patient thoroughly, make sure that they are fit for surgery. Then, based upon their age and comorbidities, whether they have diabetes, hypertension, etc., we will get the necessary fitness from the concerned specialty, cardiologist, urologist, uh, pulmonologist. From everybody, we will get the fitness, optimize the patient nicely, and then we will plan for the operation. Based upon the requirement, we do open surgery, we do laparoscopy, and we do robotic surgery, and we do abdominal wall reconstructions also.
Okay. So, Dr. Prem, if somebody wants to get in touch with you for any kind of hernia-related consultation or any kind of
Yeah.
therapies, how they can get in touch with you?
Get in touch with me. Can I give you a number?
Yeah, yeah, sure, sure. I'll share the number in the description.
Just take down this number 98403 98403
Okay.
37642. 37642. So
Okay.
this is the number to the institute's private secretary. His
Okay.
name is Arun.
Okay.
So you can contact him and he will put you on to me. Yeah.
Okay. Fine, fine. Got that. Okay. Thank you very much, Dr. Prem, for
Such a
giving us
pleasure.
guidance on this very common condition, but where people are avoiding it. And I hope this video's information has been useful for you. Please follow the tips and guidance given by Dr. Prem. And if you are somebody who is already suffering from hernia, or if you are looking for some kind of consultation, you can get in touch with Dr. Premkumar. And for the contact details information will be provided in the description section or the comment section of this video. And if you are not subscribed, please subscribe to this channel and share this video with somebody in your family or your friend who is suffering from hernia. And that's all for now. We will meet in next episode with another medical expert and doctor on talking on another different topic. Till then, Dr. Nitin signing out. Thank you.
Thank you.